So, the Choi, there's quite a lot of questions actually for the Choi pen. Why do you use Choi? Why do you prefer?
Yeah, we try many techniques about transplantation. And the Implenter pen, we call it Implenter pen.
Okay.
In this method, there's less scar, and the healing time gets shorter, and also it looks natural after the operation, and you can put the hair without cutting the native hairs.
Okay.
You can put the hairs between them, and you can gain high density.
So you would say it's better to use this pen?
Yeah, you see the pen brings the hair under the skin, and it goes back without hurting the core of cells.
So for the angles and so on?
Yeah, of course. With the pen, you can set the angles, direction, and the deepness. Also, there is no possibility to put hair at wrong places and wrong direction.
Dediği gibi açılar rahatlıkla ayarlanabilir.
Now you can see the angles.
So you would say the pen is better to use for in between native hair?
Of course. And also there's, you see that there's less blood, and you can see the operation area easily.
Sıklaştırma için yapılabilir bu şekilde.
You don't need to clean, or you don't need to give a lot of water under skin.
I've noticed some the dots on the pen. What are the dots for? The dots on the...
Yeah, you can... it brings with small dots. Oops, I'm sorry. Yeah, like that. And also the hair sticks in the skin after the pen goes out, and you don't need to risk to lose it after operation.
The depth's very important. So how do you measure this with it?
Before the operation, they will check the skin thickness, oil situation, and now we set the pen's length to the skin.
Okay.
Also, it's changing to the front to back. We use shorter one to the front side, and we use the little bit longer one to the vertex and the crown area.
So I see that the nurses are involved in the extraction using the micromotor. Some people ask quite a lot of questions about the micromotor due to it and the manual punch. Why do you use the micro?
They are the same methods actually.
Okay.
The micromotor use the same movements with your hands, but the micromotor's needles is a little bit sharper and a little bit shorter.
Yes.
And also you can, if you use it well, if you use the micromotor well, you can cut the skins regularly and the same shapes for all places.
Okay.
And also, you don't have to push so much. With the manual punch, you have to push to cut the skin, but motor has a spin effect, and you don't need to push, and it not brings the big scars like the punch, manual punch. And we prefer, we use the micromotor for this.
Okay, but the nurses, how much experience have they got?
Yeah. We are working in this surgery over 10 years.
Okay.
We have many nurses work here, but the new one for 3 months, but she don't involve the operation right now. She's just in the education. The older one is about 10 years maybe.
10 years?
Yeah.
And is the doctor involved, Dr. Hakan, is he involved in all the implantation?
Yes. In all operation, the doctors follow all procedures, and also he makes the operation by himself.
So he designs the hairline?
Of course, yeah. The doctors design the hairlines with the patients. They will decide it together, and then we make the anesthesia, and also the doctor makes the operation, and the nurses just help to replace the hairs to the pen. And you see that. The nurses trained by 6 months by the doctor before they get involved in operation, and they should very carefully to put the hairs to the pen. They don't damage the cores. Yeah, you can see that. They put very slowly and very carefully. It's very important.
Is it okay if I ask the patient?
Of course, you can ask some questions, patient.
How are you feeling?
Feeling, yes.
Are you okay?
So,
You've had 1,000 grafts.
1,000 grafts.
This is, you've had 3 procedures. Not with Dr. Hakan, you had one before. FUT.
Ne demek?
Daha önce de ameliyat olmuştun, saç eklemiştin ya, foot'la. Foot, yeah.
2005.
Okay.
Oder Almanca mı konuşuyorsun?
Yeah, you can speak Dutch.
Speaking the
Yeah, that's
German. 2005 hatte ich eine Foot-Operation, was natürlich nicht gut verlaufen ist. Und dann habe ich mich natürlich bei Dr. Hakan Doganay mich mehr gemeldet und bin total zufrieden natürlich. Sie sehen, ich habe keine Schmerzen. Ich bin zum 3. Mal hier, weil es mir einfach gefallen hat. Den ganzen Bart hier unten wollte ich loswerden, damit ich dann eine dichtere Haarpracht bekomme.
Nice.
Also das soll keine Werbung oder so sein, ich sage die Wahrheit hier und einfach perfekt.
Yeah, thank you.
So you're happy?
Yes.
Very good. And when you extract the grafts, what is the solution that you put it in? How do you preserve the grafts so they don't get damaged after extraction?
Yeah, we use the saline solution. We added something in it to keep the hair grafts live.
Okay.
And then we keep it in the fridge there.
Okay.
I will show you. Yeah, all grafts put the separate glasses into the solution, and we give the number to them. And usually we put 100 grafts to one plate.
Okay.
And we know exact count. And also, I want to show you something. We write the plate number, and also this is the singles, doubles, and triples. Now the patient know which graft extracted and exact counts with the singles, doubles, and triples.